The flu. It is already widespread in 2/3 of the nation. Patients are flooding hospitals and doctors' offices, leading to a fear that the popular treatment Tamiflu could be in short supply. Tamiflu needs to be taken as soon as the symptoms start and can shorten the length of the illness. There's no shortage of the drug yet, but not everyone may get it. And if you're young and otherwise healthy, you're likely will be told to go home and rest.
There are a lot of misconceptions and questions about the flu, especially with it being so severe this season. We asked for your questions today on Facebook, and Kim Greenwald joined us this morning on Daybreak, and she's an infection control coordinator at Saint Mary's Healthcare. And Kim joins us once again to answer some of your questions. Thank you for joining us.
Thanks.
Busy day.
Yes.
Let's get straight to our first question. Lisa Lyons Sturgeon asks this: what is the percentage of people who still get the flu even though they had a flu shot? That's a good question. A lot of people think, if I get the flu shot, I'm not going to get it.
Yeah, and that's not necessarily the case. The flu shot is the best we have to prevent the flu, but some people still, depending on age, other problems that they have with their health, may actually develop the flu. What the flu shot does for us is helps us so that the flu that they get is not quite so hard. So they may get the flu, but it doesn't knock them out as long as it would normally without a flu shot.
And we're hearing that it is severe. It's hitting people hard.
It's unpleasant. It's very unpleasant.
Yeah. Sarah Send asks this: does Tamiflu really help?
Tamiflu needs to be taken early in the course of influenza, within the first 24 to 48 hours, and it will help lessen the symptoms. Not necessarily the length, but you might not feel quite as sick. So it does help, but Tamiflu needs to be given appropriately as well. If you're young and healthy and you don't have any other health issues, generally you should be told probably to go home and, take fever reducers, drink fluids, and rest. But if you have other issues, like if you're diabetic, if you have breathing problems, heart problems, etc., then you would be a candidate to receive Tamiflu.
But there's that pivotal time, too,
There's
to get in there.
There's a pivotal time, yes.
Yeah, to get in there and get that before the illness takes effect.
Correct.
Really, yeah. Okay. Left Eye says that everybody's talking about getting shots and getting drugs for the flu. Is there a holistic approach? What's your thought on that?
Well, I always think about when we were kids and there weren't all the flu antigen testings and options. It was you were told to go home, rest, drink fluids, have chicken soup, and be babied. And that's really the best thing from a holistic standpoint, is be around those who love and care for you and who are willing to get you bendy straws for your glass, because those are very important,
Right.
the comfort things.
Sure, and just kind of weather it and,
Yes.
and try and lay low a little bit.
Yes.
Sukna Wilson wants to know if you can get the flu again once you've had it this season. That's a good question, because you think, okay, I had that earlier in the season, then spring rolls around and it sort of seems like this other wave comes of flu, Are you done with it?
That's a tricky question, and I'll tell you why. You will not get the same strain again, but you could get another strain again. So if you have the H3N2, which is an A strain, you could conceivably get a B strain as well. So yes, you could get the flu, you just won't get the same strain.
So you could get it again in the same season?
Yes.
Right. Okay. Marie Kovarik asks, when should we stay home from work or school, and at what point should we see a health professional?
That's a great question, because people try to soldier on and weather through, and their coworkers are like, stay away.
True.
The truth of the matter is if you're running a fever of about 104, you should be home. If you've got a cough that's very productive, you should be home. If you've got a dry, hacky cough that you can calm with like a throat lozenge, you can be at work. But fever and a productive cough, you should really stay home.
Nobody else wants to get sick.
No.
No. Okay, Kim Greenwald, thank you so much for joining us. Once again, I'm sure these answers will help a lot of people out there.
Thanks.
Thank you.